Few things are as distracting and exhausting as tooth pain. The pain itself can be severe, but when you cannot chew properly, digestion suffers, and overall health can begin to decline. Because of this, teeth are often described as the gateway to good health. But their importance doesn't stop there. Teeth also play a crucial role in how we look, shaping both appearance and first impressions. Some people choose orthodontic treatment to achieve straight, well-aligned teeth. Others opt for whitening or procedures like veneers to create a cleaner, brighter appearance. As a result, teeth receive more care and attention than almost any other part of the human body. Yet despite all this, they're far from easy to maintain. Once a permanent tooth is lost, it doesn't naturally grow back. The treatment developed to address this problem is dental implant therapy. Today, the most widely used core material in dental implants is titanium. But among so many available metals, why was titanium chosen as the standard material for dental implants? This wasn't a simple or arbitrary choice. There are scientific and engineering reasons behind it, reasons that made this choice almost unavoidable. So what exactly are those reasons? At Dr.SciVera Studio, we'll explore them one by one. Please don't forget to subscribe. Now let's begin. Implant treatments that replace bone-like tissue with metal are used throughout many parts of the human body. Among these, dental implants are the example most people are familiar with. Even people who have had dental implant surgery often never get to see what the implant itself actually looks like. Although implants come in various designs and forms, they are generally made up of three main components. These include the implant body, which is placed directly into the jawbone, the crown, which functions as the visible tooth, and the abutment, which connects the two. Today, we'll focus on the implant body itself, often called the implant fixture. This component plays such a critical role that it would not be an exaggeration to say it determines both the performance and the lifespan of an implant. To place a structure inside the jawbone that can replace a natural tooth root, the choice of material must meet a number of very strict requirements. The materials that satisfy these conditions better than any others are titanium-based metals, especially titanium alloys. So, what scientific and engineering principles allow titanium-based metals to be implanted inside the human body and function as a replacement for natural teeth over such long periods? The most important reason titanium was chosen as the material for dental implants is biocompatibility. From the perspective of dental implants, biocompatibility refers to how well a metal can perform the role of a natural tooth root once it is placed inside the body. First, when a material replaces a natural tooth, it is crucial that the body doesn't recognize it as a harmful foreign object. If a strong foreign body reaction occurs, the immune system can become overactivated, leading to persistent inflammation and potential damage to the surrounding tissue. In addition, to truly replace the function of a natural tooth, an implant must be able to withstand the large forces and repeated impacts generated during chewing. The material that meets all of these requirements at once is titanium. When titanium is exposed to air or to the internal environment of the body, it reacts with oxygen and forms an extremely thin and dense oxide layer on its surface. This oxide layer prevents titanium from undergoing direct chemical reactions with the surrounding biological environment, and it suppresses the release of metal ions into the body. As a result, when titanium is implanted, it doesn't trigger strong immune cell responses, and it rarely causes severe inflammation or toxicity. At the same time, it can form stable bonds with bone cells. Because of these properties, titanium can perform a role that is remarkably similar to that of a natural tooth root. Beyond biocompatibility, mechanical properties are also essential when a material is meant to replace the function of a tooth. One of the key parameters considered first is the elastic modulus. The elastic modulus describes how much a material deforms under an external force and how strongly it tends to return to its original shape. In general, the higher the elastic modulus, the stiffer the material becomes. As the elastic modulus decreases, the material becomes more flexible. Human bone has an elastic modulus of roughly 10 to 30 gigapascals, which is relatively low when compared to metals. For this reason, an implant material placed in the jawbone should have an elastic modulus that doesn't differ greatly from that of bone. If the material is too flexible, it can't properly perform the function of a tooth. On the other hand, if it is too stiff, it can place excessive stress on the surrounding jawbone. In the field of dental implants today, metal-based materials are the dominant choice. Among them, titanium stands out because it has a lower elastic modulus than iron-based or cobalt-based metals. In fact, the elastic modulus of titanium alloys is roughly half that of these other metallic biomaterials. Because teeth are used constantly, any material that replaces them must be lightweight and able to withstand repeated impacts. Titanium combines both strength and low weight, making it a highly suitable implant material that meets the mechanical demands of chewing. The final factor to consider is how a material responds to temperature changes. All metals expand when the temperature rises and contract when the temperature falls. When we eat, hot and cold foods enter the mouth repeatedly. If an implant material were to undergo large deformations every time the temperature changes, it could place long-term stress on the surrounding jawbone. Titanium has a relatively low coefficient of thermal expansion compared to many other metals. Because of this, it undergoes less dimensional change as temperatures fluctuate, allowing it to function stably in place of natural teeth. As we have seen so far, for a material to be implanted into the human body and replace a natural tooth, it must satisfy many different requirements at the same time. For that reason, choosing the right implant material is by no means a simple task. One might even wonder whether modern dental implant treatment, as we know it today, could have become established so quickly if titanium had never existed. That is how significant the role titanium has played in the field of dental implants. However, this doesn't mean that titanium is a perfect all-purpose material in every situation. Did you know that dental implant surgery is not a procedure that succeeds 100% of the time? For an implant to become stable, the surrounding jawbone must firmly support the implanted structure. This process is commonly known as osseointegration. From the outside, bone appears solid and densely packed, but when we look at its internal structure more closely, as shown in this image, we see that it is actually porous in nature. As bone cells grow and remodel, they form a structure that resembles a spider web. The alveolar bone that surrounds the tooth root also has this porous structure, which is why natural teeth can bond so firmly with the jawbone. By contrast, titanium in its natural state does not possess this kind of porous architecture. It is by default a material with a relatively smooth surface. Although titanium bonds with bone cells more effectively than many other metals, stable fixation can still be difficult to achieve in some cases. For individuals with naturally low bone density or for older patients whose bone regeneration capacity has declined, the implant may not always anchor as firmly as intended. To address these limitations, technologies have been developed that intentionally create three-dimensional microscopic pore structures on the surface of implants. Implants designed in this way are commonly referred to as porous implants. In titanium implants with a porous structure, bone cells can grow into these surface pores, allowing the implant to bond more strongly with the surrounding bone. As a result, the implant has a higher chance of becoming firmly anchored within the jawbone. Research in this area has been actively carried out for many years and continues today. Some of these technologies are already being applied in clinical settings. However, when it comes to more complex three-dimensional porous designs and long-term stability, the available data are still being accumulated. This remains one of the current limitations in the field. Because titanium is a metal, it also comes with another important challenge. Have you ever heard that dental implants are said to have a limited lifespan? Of course, this varies greatly depending on an individual's oral condition and how well the implant is maintained. Still, when people talk about implants, a lifespan of around 10 years is often mentioned in a statistical sense. But when you stop and think about it, the idea that a metal as strong as titanium would somehow fail after only 10 years of use can feel somewhat counterintuitive. In reality, the issue with implants is not that titanium itself is easily damaged. More often, the problem arises from the difference in mechanical properties between titanium and human bone. As mentioned earlier, titanium has an elastic modulus of roughly 110 gigapascals, while human bone is only about 10 to 30 gigapascals. From the perspective of the jawbone, a titanium implant is therefore a very stiff structure. Because of this mismatch, the forces generated during chewing are not always distributed evenly between the implant and the surrounding bone. Over long periods of time, this can lead to a concentration of stress in the jawbone itself. To put it simply, it is like placing a rigid metal rod on a piece of meat and pressing down from above. When this kind of condition is repeated over a long period of time, some patients may experience a gradual loss of bone around the implant. As the amount of bone supporting the implant decreases, the implant can eventually become loose or fail to function as intended. In such cases, the jawbone may need to be reinforced through procedures such as bone grafting before implant treatment can be performed again. Of course, these outcomes vary widely depending on an individual's oral condition and maintenance habits, and in many cases, they can be adequately prevented. However, for these reasons, some experts suggest that implant treatment at a very young age should be approached with particular caution. In general, the younger the patient, the longer the implant will be used and the greater the cumulative load it will experience over time. From a long-term perspective, this can increase the likelihood of progressive bone resorption in the jaw. For these reasons, some experts suggest that, whenever possible, implant treatment should be delayed for as long as is reasonably feasible. Therefore, after implant treatment, it is important to use the implant in a balanced way, avoiding excessively hard foods, so that it works in harmony with the natural teeth. When people hear the term dental implant, it often sounds as though some highly advanced technology must be hidden behind it. In reality, however, the most difficult and carefully considered part of making an implant is not how complex the structure is, but how to choose a material that can remain stable inside the human body over a very long period of time. For this reason, titanium was selected as the core material for dental implants. Once the material has been chosen, the basic form of an implant is made by machining a titanium rod, in much the same way as an ordinary screw is manufactured. In some cases, specific chemical or physical surface treatments are added, but the process itself does not require technology that is as complex as many people might imagine. As a result, the manufacturing cost of the implant fixture itself is not as high as many people tend to assume. Seen from this perspective, the fact that dental implant treatment is still regarded as a costly medical procedure in most countries can feel somewhat ironic. Today, we explored from a scientific perspective why titanium-based metals became the standard material for dental implants. When designing materials, satisfying even a single physical property can be extremely challenging. Yet, titanium manages to meet a wide range of requirements for implantation in the human body, including biocompatibility, mechanical performance, and durability, in a remarkably balanced way. That's why titanium plays an essential role not only in dental implants but also in fields such as aerospace, mobility, and the energy industry. The more you learn about it, the more fascinating this material becomes. That brings us to the end of today's story. Next time, we'll return with another story about the science hidden in the world around us. Until then, stay curious. I'm Dr. SciVera.